have we got a guest for you this morning, someone who's going to help us all speak better, and the subject is speech and language therapy. Nina Godson, how are you?
I'm fine, thank you. Good morning.
Good morning, Nina.
Are we doing all right? Are we speaking properly?
Very well, very well. Good job.
Is there a great need for speech therapy in Barbados?
Yes, there is. If we look at the UK statistics, you have about one speech and language therapist for 20,000 population. We have about 6 speech and language therapists currently on the island here for a population of 270,000. So those of us who are here, both private and within the government system, have our hands full.
So do you actually do see a lot of need for a speech and language therapist? Like, there are people out there with that significant number of people out there with problems.
Yes, we work both with pediatrics and adults. So we're working with children with developmental delays or syndromes or various disorders, autism spectrum disorders, Down syndrome, cerebral palsy, for example. And then we work through childhood, school-age children to adults with stroke. So there's a real scope with our clientele from birth to death, basically.
Wow. And especially in the younger generation, are you seeing that big a problem, and what are the major things that they present?
We are seeing a lot of, well, first of all, I would say about 10% of children enter school with some form of speech and language delay. This might be articulation, relating to how they're articulating their speech sounds. It might be their language development. Are they meeting their milestones for their age? Have they reached how many words they should have? What's their grammatical structure like? Morphology? Do they have all the verb endings in the correct place? Do they have all the grammatical markers there? And then, of course, the big phonics question with literacy and reading. Are they attaining their phonics? Do they have a good sound knowledge in their phonics and phonological awareness skills to help them through the curriculum?
What are the danger signs, though? I mean, at what point do you realize that I need to see a speech therapist?
It starts very early on, actually. Going on from, you had Ben Stabler on a few weeks ago talking about hearing. We want to make sure that they're hearing correctly, and so it is important that they have their hearing tested at regular intervals. And then, as a good gauge, by the age of 2, a child should be understanding at least 300 words, and they should be saying expressively at least 50 words expressively by the age of 2.
How do you deal, though, with the parent who says, no, not my child. My child is perfect. There's nothing wrong.
It is a challenge, but that's where the pediatricians should make the referral onto speech and language therapy. And just remember that early identification intervention is key, that the longer you leave it, the more you're having to undo and redo. It takes a lot longer to correct.
How do you determine a child who is just a late starter as opposed to one who has a problem?
We have standardized assessments that we will do, but as I said, as a gauge, if there's a family history, then we know that there might be, a developmental delay there. But certainly, if by 4 years of age and you're not having 1,200 words in your vocabulary and you're not talking like a little adult, there's definitely cause for concern. But we do formal standardized assessments which will match you where you should be chronologically for your age.
On the other side of the coin, I have a 9-year-old who is a wordsmith, and he talks like he's 35 years old. Is that a problem?
No, it sounds like he's fine. Go ahead.
No, I was going to ask, my question is going to progress to older people, so if you're going to finish up with the children.
That's fine. Go ahead.
Okay. So I'm trying to get a feel then of, among the older population, what are some of the major challenges that you see?
Predominantly 50% of my caseload is stroke patients.
Stroke.
Yes, we have a high incidence of stroke on the island with our hypertension and diabetes. It is a real concern. I see patients immediately post-stroke. Initially that starts with a swallowing assessment, also known dysphagia, to check that they're swallowing okay, because that can be affected post-stroke. And then you get implications for aspiration pneumonia. But also early on their communication is often impaired, and people don't always realize how impaired it is because the patient appears to be nodding and following all the social cues, and you ask them how they're doing and they're, how are you doing? And they're just nodding back, looking at your face, but in fact they're not understanding the words that you're actually saying. Or they might have what we call jargon aphasia, where the words that come out they don't make any sense at all. So there's a lot of scope for speech and language therapists here on the island.
Is it more difficult with the adults or with the children?
It depends what
to correct.
It depends what you're correcting. I would say in terms of language with adults, it's already developed, so it's been impaired and you're trying to remediate that. With children, they're still developing, so it's more dynamic, it's changing, it's really quick. And it just depends on your preference. I like working with both. I work with both cases.
In the case of kids, it's an evolving experience. With mature people, though, it has got to do more with will than anything else, doesn't it?
Has a lot to do with the individual person and their motivation for rehabilitation. It does. Some people give up too soon. It's not a quick fix. It does take a lot from that person. And, you know, depression is part of the natural course of rehabilitation. So a lot of counseling is involved as well. Family support is important. But also the education. A lot of people don't know that we're here and we're here to help. So if you know of anybody that would benefit from speech and language therapy, make that call and hopefully we can help you as best as we can.
Well, we're going to make a call right now to our good friend Sergeant Siebert Johnson, so stick around and we're going to get the final update for traffic on this Friday morning. Good morning, Sergeant. I just need the assurance from Sergeant Siebert Johnson that all is going to be well across the pine when I leave in a few minutes.
Should be, my friend.
Good.
Great.
What else is happening?
All roads, we have heavy flows on all of our major roads. Highway 7, Matson and Talbot heading towards the city, those areas are building. Along Highway 6, Sergeant Village, Upper Culmrock, Bishop's Court Hill, those areas are tight. Fords Road, also heavy. Highway 5, inbound flows were heavy on Map Hill going towards the city. Heavy traffic reported on Pine Hill, Belmont and Constitution. It's also heavy on Highway 3, Household Turning, Watford and Station Hill. Highway 4, going on to Malloys Hill, Welches, inbound flows were building and slowly moving. Highway 2, Jackson on Green Hill, conditions are heavy. Voice on Royal Map Highway, conditions are steady. And heavy traffic also on Highway 1 is more to set towards the city. Voice on Oxners Road, Husbands Road, University Drive and Spring Garden, there's a steady build-up. The ABC Highway conditions are also light. Doug, I wish you all the best. Joe, enjoy your weekend. And to all listeners, have a great one. And to my little grand, his birthday is today, Miguel. I want to wish him all the best too. Have a good one. So until Monday, there has been no traffic.
And happy birthday from us to Sergeant Siebert Johnson, and you continue to make it a fab Friday for you and all the members of the constabulary.
Great, my friend.
Okay, and we're back with our discussion now on the science of speech with Nina Godson. Nina, is there a great deal of demand for your expertise in the schools, and if so, how is it used?
Yes, we are. Speech and language therapists do work very much in schools, and we do some screening programs where we go in and screen children at the age of 4.5 to make sure that they're following and meeting their developmental milestones as they should. Those of them who are not, we then offer speech and language therapy in-house. And we're working with the teachers as well. And this is to improve, as I said, either articulation, improving their syntax, their use of language with their grammatical markers, and social language as well. Some children have social communication difficulties. Not only do they have the content and form of language, but they're not using it as they should.
And John has a question for you. Good morning, John.
Morning, sir.
What is your question?
I want to know if you could explain stammering or stuttering. I heard one therapist say that it was learned behavior and it can be unlearned. But that therapist himself stutters, and I'm wondering what. I always thought it was some sort of neurotic or brain disorder or something like that. Could you explain, please?
Thanks.
Good question. Thank you, John.
That is a very good question, John, and I'll try my best to explain it. There are a lot of theories out there as to what causes stammering or stuttering. Both terms are used interchangeably, and they actually don't know. The latest research is that the brain, it is neurological, he's right, and that the brain does misfire in the brains of those people who do stammer. They argue that there is no cure. Our therapy targets moving through the communication to try and prevent the person from breaking down in communication, but learning strategies to move through the communication. It can be, you can have 4 different types of stuttering, and you can either have one or all 4 together.
But I know of a case where it's a very well-known country western entertainer, Mel Tillis, who stuttered every 3rd word, but he sang beautifully.
That's
and never
right.
stuttered.
Yeah, interestingly, it's a different part of the brain. Music is separate.
That's interesting.
Yeah, it's
Well,
interesting.
Nina Godson, good to see you. You're going to be back with us. This is going to be a regular, ongoing experience on Morning Barbados, and we're going to solicit phone calls and queries, Facebook, and using social media to communicate with you on this program.